Okay, so the automatic brightness stabilization. Here's your video on that. So the automatic brightness stabilization and the automatic brightness control is interchangeable. So you'll hear on the newer systems we use the ABS instead of the ABC. Depends on the system. So it's a part of the fluoroscopic control system that keeps the light output of the image intensifier consistent over various patient attenuation and geometry. So it depends on how thick the patient is and how dense the tissue is, and it'll compensate without you having to do it. The system is shared with automatic exposure control systems, which maintain the constant film density. So fluorographic, and then there's spot films. So those are the two different systems. So the ABS or the ABC varies with the kVp, the MA, and the pulse time, or just the time. Doesn't have to be pulsed. So the automatic brightness stabilizer, the goals of the automatic brightness stabilizer is to keep the brightness consistent over various thicknesses, ignore information at the image margins, preserve image contrast and minimize image noise, keep the operation within rating of the X-ray tube, effect a reasonable compromise between patient radiation dose and image quality, keep patient radiation dose within the California radiation control regulation requirements of 10 rads per minute, except when override or boost is selected, which I hope you guys never have to hit. Respond fast enough to track during an examination, but slow enough to avoid hunting between the bright and the dark portions of the image. Be able to be capable of being disabled or held at a particular setting prior to injection of contrast. Capable of being shut off to permit the manual controls. And lastly here, display the operating factors and modes of operation for the fluoroscopist. So variations with X-ray factors. So operations of the system at higher kVp values will result in increased transmission of the beam through the patient, so less radiation is required, so that's good. Brightness of the image varies directly with the MA and approximately the square of the kVp change. So if you increase kVp by 10%, the result is 100% or doubling in the brightness. The ABS would respond by reducing the MA by a factor of 2 to maintain the output brightness. So your automatic brightness stabilization in your kVp, as kVp increases, image contrast degrades. So ABS should be operated at the lowest, or I'm sorry, at the highest kVp for the reduction of radiation dose to the patient. So using a lower kVp is best for image contrast. So as you go up in your kVp, your contrast degrades. As you go down in your kVp, you get better image contrast but higher dose to the patient. So if you're imaging something with low contrast like the abdomen, typically you want to go with a lower kVp, but once you get barium in there you have a high contrast, so you will want to increase your kVp. So brightness sensing. It can be sensed in 3 different ways. So the image intensifier photocathode current. So the photocathode of the II connects to the current amplifier, so amplifier output is proportional to the radiation input of the II. Number 2, the television camera signal sensing. So most TV cameras have automatic gain control, so circuits for controlling the camera tube voltage or the gain in a video amplifier in order to provide a constant output signal over variations in image brightness. And then there's lens coupled phototube sensing, so a lens combined with a prism or mirror so that the collimated light from the image intensifier is sampled and the image of the output phosphor is formed over an aperture placed in front of the photocathode tube. All right, types of automatic brightness stabilization circuits. Brightness stabilization can be classified in terms of variable controls or by the brightness sensor. So we have variable MA and present kVp. So the operator presets the kVp and the brightness sensor controls the tube current over a range of about 20 to 1. So you have variable MA with KBP following, so varying MA as the fluctuation of the brightness sensor, but has an additional circuit that senses if the upper or lower bounds of MA has been exceeded and adjusts the KVP through a motor-driven variable transformer. So if the MA rises above a certain preset value, then the motor drives the KVP value up. So then there's variable KVP with selected MA. So brightness sensor controls of the KVP of the system. Value of MA is required. So you have to know what MA you're going to be using. And if motor-driven variable transformer is used to select KVP, restabilization is rapid, which is good. You want it to be fast. Types of automatic brightness stabilization circuits continued on here. So you've got the variable KVP and the variable MA. So your output of the brightness sensor controls both the KVP and the MA in order to maintain either constant image signal or constant image contrast. Difficult for the operator to select the mode of the operation best suited for particular exams. It's hard to tell. And then the last one here is the closed circuit television, which we are actually going to be talking about next week. That's all you got for your automatic brightness control and stabilization.